Good morning. My name is Chuck O'Neill. I'm Deputy Executive Director with the Kentucky Board of Emergency Medical Services in Lexington. It is April the 15th, 11:01 a.m., 2020, and this is a COVID-19 EMS Administrator's Update. I pass the microphone off to Executive Director for K-Beams, Michael Pointer. Mike.
Thanks, Chuck. And first of all, I want to thank everyone for taking time out of your schedule. I know we're all extremely busy right now, and we've got a lot going on, so we'll get right down to it. Today, I've asked Dr. Stack to join us. This event that we're dealing with is changing by the day, and I invited him to go over some of his thoughts and ideas on where we're at and where we're going. So Dr. Stack, I'll turn it over to you.
Thank you. Thank you all for being here, and thank you all for being on the front lines in your efforts during this emergency response. I think when Mike asked if I would speak, I had shared some remarks at the Emergency Operations Center last week. One of the things I would encourage and ask is that everybody be very attentive to the emotional and mental health of our workforce. What I'm seeing, and I'll roll this into a bit of an update for you, what I'm seeing as we make phone calls around the state is that these communities that are affected by this really reach very quickly a state of crisis. The update part of this would be that as we find the infection enters and spreads into some of these senior living communities or nursing homes, the pattern that I have observed, which is fairly consistent, is either staff or residents become ill, then staff become ill. Staff who are ill don't come to work because they're home ill, self-isolating, but then other staff don't show up to work because they're scared. Then residents become ill, some of them become sick and get sent out to hospitals. And what happens pretty quickly is then nursing homes or elder communities find themselves without sufficient staff to provide care. And then administrators for these facilities become quite understandably quickly overwhelmed. And the entire workforce can quickly become traumatized and distressed. And then, of course, that can spiral out. It affects the EMS delivery system in their communities, as you all know very well. I'm talking to the community of EMS folks around the state. Not every community or municipality has the same resources. So we can very quickly find that a 1 or 2 ambulance county doesn't have the capacity to keep up with the demand. Even in large cities, obviously, with bigger populations, this can become a problem. And then the hospitals start to have difficulties because they're receiving patients that they would not normally see with either relatively minor illness or request for testing, or they start seeing patients who are actually quite sick, and they start taxing the local hospital's ability to provide the care needed. The thing that I have found in having numerous discussions around the state is the way we get through this is just like the governor says, we get through it together. And we have done numerous calls now with local hospital leaders and also the nursing home leadership and the local health department leadership and the Kentucky Department of Health team members, trying to bring them together to work through the issues. Sometimes there have been other components engaged. Perhaps I'm not sure if it hasn't very regularly been the EMS community, because usually these things are last-minute, short-notice crisis calls, and we have to go through a whole journey together to try to get everybody to trust each other in a world where frequently trust is not a strong suit, and work together as a community under very different rules and engagement. So we are going to clearly need to work together as an entire state across all of our different communities, and EMS is essential to that, as I know you are all aware. I want to remind you I'm an emergency physician, so I have spent up until March 1st, when this disaster response forced me to have to step aside from that. I have been an emergency physician my whole career and worked with EMS for my entire professional career as an emergency physician. So I'm very grateful to what you do and have had wonderful relationships with my colleagues in EMS over many years. and for 13 years was on the Emergency Medical Advisory Board for Lexington Fire and EMS in the city of Lexington. So I'm very grateful for what you do, but do ask that those of you in leadership please attend to the mental and behavioral health needs of your workforce, and also be attentive to and sensitive to the distress people are operating under, both at nursing homes where you pick up patients and at hospitals where you deliver them, because we're going to all have to come together and care for each other and about each other to get through this. But I have seen numerous communities come together and rise to the challenge, and so I have absolute confidence we can do that, but it will take a lot of work. Mike, do you have any other specific questions or any other things you'd like me to address before I step aside for you?
Yeah, I think Dr. Stack, if you could just highlight the importance of notifications if we do have surges in different parts of the state.
Thank you. Yes, thank you. So one of the things that came up in a community, and I'm not going to mention the communities because I don't want anyone to misunderstand criticism, that we have nothing but support for each other, and a lot of things we have to let roll off in this current situation. But we were unaware. We thought that things were working fine in one community, or at least that they were working tolerably. I don't know that there's any fine at the moment, but the EMS system in this small rural area was taxed. There was either one ambulance having to go back and forth between a nursing home and a hospital, and then having to decontaminate between runs. And then if they have to transfer a patient from the local critical access hospital to the bigger hospital in the region, of course, you all know what that's like. If you only have two rigs in the county, then you either have only one rig left, or if you have one rig, there's no rigs left. And so it's a real problem. If you are noticing in your community this pattern unfolding and it does not appear that there's coordination, please reach out to Mike and let him know, or if you have a contact with the State Health Operations Center, reach out to us so that we're aware. You may be the first entity that reports to us that there's a problem unfolding, and then we can maybe intervene at an earlier stage before tempers get further frayed and anxiety rises to a level that's even more difficult to unwind and address. So thanks for reminding me, Mike. I'd forgotten about that. But if you see a problem, please let someone up the chain know so that perhaps we have a chance to intervene and be helpful.
Thank you, Dr. Stack. I really appreciate you taking time out of your busy schedule and joining us today. I think it's very important for everybody to hear from you. So we're in this together, and we've got your back. Okay, we'll go ahead and move down the agenda. Paul Phillips, our Director of Field Operations.
Thank you, sir. So I'll keep it brief. We do have 8 new emergency regulation modifications that have been posted on the KBEAM's COVID website. They are related to agencies and medical directors. That's both air and ground agencies and medical directors. You can read them there. We're going to have a conference call Monday afternoon at 2 p.m. Eastern. I will be sending out an invitation to all of you folks later today for that call. We chose to wait until Monday because we didn't want to overwhelm you guys with calls. We know today is this one, and then tomorrow we have one for the educational regs, but we also want to make sure we're providing you all timely information. As well, just got a call, wanted to share out with you all as well, and I'll share it in the chat. I'll share the phone number in the chat. I got a call from Anchorage, Middletown. They have 150 to 200 King Airways with about a year and a half shelf life. They just switched their Rescue Airways, their BIADs, and they're wanting to offer these up to agencies that may be in need. So if you want to reach out to Captain St. Clair, and I'll share the number in the chat, but I'll go ahead and shoot it out for those of you who are listening and just want to jot it down. But it's 502-245-7555, 502-245-7555. And that is at Anchorage, Middletown, and you can ask for Captain St. Clair. Just as Dr. Stack was sharing, I just want to implore you guys to keep an eye on your employees. I know this is administrators, but this is a tough time for everybody. And then I know that, everybody, all of your employees have to go home to their families, and it can be stressful. It can be scary. So just make sure you're keeping an eye on each other, and just make sure you try to find some type of coping mechanism that is healthy. And just again, just keep an eye on each other, guys. You guys are really doing a great job, and just make sure that you're continuing to do it. One more item to share. So we have an abundance, and Bob will probably share numbers, but for the agency administrators on the call, I want to also just stress. We're bringing these providers back into the workforce, but they're not having any continuing education. We wanted to get them back in so that you guys could use them as quickly as possible and just not have zero barriers to them entering back into the workforce. But bear in mind, some of these people have been gone for a while, and there are going to be some learning curves here. Technology has changed, medicine has changed. I know personally, I would need a little ramp up time if I came to an agency right now to work on an ambulance. So keep in mind that these folks are coming in without any continuing education, and we will also, they'll just need some orientation. So keep an eye on those folks that are coming in, and just make sure that you're orienting them to your policies and to, the new medicine and technology. So.
Thank you, Paul. Next up today is Robert Andrew, Director of Education, Training, and Certification. Bob?
Oh, thank you, Chuck. And I want to thank all of you for your dedication and the service to your communities. The first thing is our certification and licensing processing is in full swing. On April the 9th, the emergency orders were signed by our Executive Director, Mike Pointer, and on April 14th, which was 6 days after they were signed, our two certification and licensure specialists who are working very hard to process these applications daily have processed 204 reinstatements under these emergency orders. The breakout, EMR, there were 18 reinstated. EMT, there were 111 reinstated. AEMT, 4 were reinstated. And paramedic, there were 71 reinstated. And as Paul mentioned earlier, the services should run these folks through their orientation process, orient them to your protocols and any education updates that you think that they need. And if you're able to, some supervised calls and mentoring wouldn't be a bad idea. We're going to have a webinar tomorrow at 11 on the emergency orders that impacted the personnel regulations, the 201 EMR, the 301 EMT, the 330 AEMT, the 401 paramedic, and the 601 training and education, and the 701 scope of practice matters. You can access these from our website, kyems.com, and click on the COVID-19 banner, and you'll see all of these emergency order regulations listed. It would be a good idea to review these and make sure that you're familiar with these. And I look forward to you all attending the webinar tomorrow on these changes. Thanks, Chuck. That's all I have.
Next up is Drew Chandler, Data Administrator. Drew?
First, I want to promote the Heads Up Kentucky EMS push notification service. This is a mobile app that you can download from the Apple App Store and the Google Play Store. This tool lets us push out information much quicker than several thousand emails from KEMSIS. So if there's something on Mike Pointer's desk and it needs to get out rapidly, you'll get it first through that Heads Up app. Again, that's Heads Up KYEMS. I also want to point out and have you check out the COVID-19 page on our website that several individuals in the office are maintaining. The most recent additions to that page are Mike's emergency orders, as are the checklists for each of the provider levels. And these documents answer almost every question that we're seeing right now in the support portal. In light of recent emergency orders and waivers, there's been an influx of individuals trying to access their KEMSIS account after an extended absence from the system, or in some cases for the first time ever because they left the EMS system prior to the current version of KEMSIS. Unfortunately, we've already seen an individual blatantly deceive us in order to gain access to another individual's account. Thankfully, our staff has the radar on for deceptive practices, and we were able to prevent a breach. It's perfectly acceptable for service administrators to provide assistance with KEMSIS, but let me be clear, if they want to come back into Kentucky's EMS ecosystem, he or she is going to be held to the same standard when it comes to maintaining their individual certification and license. The most obvious first step is for the person to use the forgot username link on the KEMSIS login screen, and there's a video tutorial link on the sign-in page if they need help with the account recovery process. Helping is okay, but fraudulent use of KEMSIS and K-stars will not be tolerated. Our team is on alert, and we will lock down accounts to maintain the integrity and validity of our systems. If you need help helping someone else, we've got the support portal. You can contact us in the EOC. We're here to help. We're processing as quickly as we can, but we won't compromise on security.
Yeah, folks, as you go through and you're helping people, it's really imperative that people are working in their own account. The one that Drew mentioned specifically was someone trying to intentionally take over someone else's account, which includes your date of birth, your social security number, all kinds of identifiable information that could end up being a identity theft type situation. So that's why we're so very specific about account security. I've got just a few things. Obviously, all you good folks are working hard, and you've probably been monitoring our website and may have gotten push notifications through our Heads Up. Just as Paul and Bob and Drew spoke about, we do have 14 total emergency orders. Those are split into two groups. We did 6 emergency orders on certification and licensure to try and reinstatement to get people back into the system. And then 8 were signed and put into effect yesterday on ground and air ambulance. So Bob Andrew will be having his webinar tomorrow on certification and licensure and TEI information. And Paul will be holding a webinar on Monday for ground and air ambulance emergency orders. All the modifications to these regulations are to help you have a massive influx of personnel in your personnel pool, and to remove any barriers for you providing continuity of EMS in your communities, as we expect that you'll have staff members that become ill, and you'll need to backfill positions and be able to continue to provide EMS to your communities. Again, just to reiterate with the reinstatement process, we're doing everything that we can to get those folks in and get them certified and licensed. They're out there. So this time next week, you're going to see 300 or 400 additional EMTs, EMRs, advanced EMTs, and paramedics in the system. So if you need people will be reaching out to you. But if you need people, now's the time to try to start advertising for paid personnel, volunteers, etc. Now we're going to try today to stay away from a lot of regulatory questions, because we are doing specific webinars to answer those questions on Thursday and on Monday. But if you have time between now and then, just log on to the KBEAM's COVID-19 website and review those emergency orders. We're still staffing the state EOC. Right now it's 5 days a week, 10 to 12 hours a day. Today, Mike Pointer and Drew Chandler are there. And if you all need anything from us, any resources that we can help you obtain, or any questions that you need answered, feel free to reach out to us at any time. And we'll start the question and answer phase of the meeting. If you have any questions that you'd like the staff to address, feel free to type those into the chat box, and we'll try to get to them one at a time. Thank you for being with us today, and thank you all for everything that you do every day. Okay, first question I'll give to Mr. Pointer. Mike, Jeremy asks, it's my understanding there will be an alternate care site in the Louisville area. Are there any plans to set up additional sites in the extreme western region, such as Paducah? Mike?
Sure. Yeah, right now we are in the process of finalizing. We should be open for business today in the Louisville area. It's going to be under lock and key. It's going to be on the ready. It's just going to be for standby purposes. We hope we never have to use it, but if we do, it's there. And to answer your question on other parts of the state, yes, we're evaluating north, south, east, and west. So there might be an opportunity or a challenge to set up something in an urgent manner. The hospital on the Louisville Fairgrounds is sort of our test pilot program. So it will be online from what I understand this afternoon, and we'll take it as it comes in the future for an expansion or a surge across the state.
Thank you, Mike. And also, so there's a couple of different things to Jeremy. So we've got the alternate care sites, and then there's something that they're calling a non-congregate sheltering. And it's my understanding right now, these plans are still in the process and these places are not open yet. But the state park system, which I believe they're actually evaluating Lake Barkley Resort today for the state park system. But that's going to be for what they call non-congregate sheltering for healthcare personnel that need to be quarantined, that are positive and can't go home or don't want to be around their families and spread it. Healthcare personnel are going to have first access to those. And I believe the first two facilities in the state park system that they're working right now are Lake Cumberland and Lake Barkley State Resort Parks. We'll go to the next question. Next question is there a strike-through edition of the emergency regulations that can be shared? I think that's Dan. Yeah, we'll email you one, Dan. Paul, can you remind me we'll send Dan a strike-through edition. Can you please advise when antibody testing will begin for emergency services personnel, specifically EMS, fire, and law enforcement? This action would assist in mitigating psychological warfare. COVID-19 is wagging. Thank you. Mike, can you address antibody testing?
Absolutely. Right now, we are testing first responders are a priority, healthcare workers in Franklin County and here in Frankfort. As for out in the field, we are working with Kroger, and I believe the governor did announce yesterday the expansion of some different locations. And to answer your question, healthcare providers and first responders have a priority on that.
And just to reiterate what Mike was talking about COVID-19 testing, is you do have to be symptomatic in order to register for that testing. They're still not testing anyone that's asymptomatic because it can provide false negatives on those tests. Now, antibody-specific testing is still being researched, and I haven't heard a lot being discussed statewide about antibody testing because the scientists don't know yet that even if you hold the antibody, if you can't be reinfected. I know I think it was South Korea, they've had some individuals that have had COVID-19 multiple times. So they don't know much about if you carry the antibody, if you can or cannot become reinfected multiple times with the disease. But I haven't heard a lot of Q&A or a lot of discussion regarding antibody testing specifically.
And I was talking with the state epidemiologist this morning, and I don't think we're just there yet. I think that will be after things calm down a bit, but there will be availability downstream with that.
Is the process for approving a protocol any different than it normally is right now? In particular, I'm wondering about a protocol concerning ARDS treatment related to COVID-19 that may be time sensitive as far as approval goes.
So as it stands now, the process is no different than it has been in the past. We are exploring some options for a little bit quicker approval, but as it stands now, it is still the same, and we'll share those out just as soon as we make any changes going forward.
Jim asks, what would be the process for an EMS agency to partner with a local hospital to obtain COVID test samples at home from patients, specifically from a medical protocol or regulatory standpoint? In the emergency orders, EMTs and paramedics are authorized to provide COVID-19 testing after they've received appropriate training, but it is within the scope of practice to obtain COVID testing samples from patients. So that being said, Jim, all you all would need to do is reach out to your local hospitals and work locally on testing. If they want you to go out and do testing and you agree to go out and do testing and have enough PPE to do those types of things, we would encourage you to do it. Can you briefly review the process of testing an employee that is symptomatic? I can let Mike speak to this, but Mark, also, if you have an employee that's symptomatic, it's important to remember, obviously we're around COVID-19 patients right now, but they could have the flu, they could have a common cold, but we want you to send everybody home that's ill. If they're sick, they need to be home and not on an ambulance. From there, you can coordinate with your local health department on COVID-19 testing and whether they feel that your employee meets the threshold for COVID-19 testing. Next question is any update to the non-transport paradigm? The emergency orders cover specifically under medical direction. Medical directors and agencies may now develop treat and release protocols as well as telemedicine protocols. So what I would ask you to do is go back into the emergency orders and read through those, specifically for your question on ground agencies and medical direction. So what we want you to do is to develop those treat and release protocols on a local level. And what we're trying to do by placing the onus on the agency and the medical director, if they choose to develop treat and release protocols, is to release you from some level of civil liability. But you do have the authorization to develop those policies for treat and release on a local level now through the emergency orders. And we will probably be pushing out a guidance document or a template document for treat and release in the next week to two. Where can a city or county service go to get immediate funding? Some cities and counties are depleting their rainy day funds quickly. There's very limited funds coming in due to shutdown. Some services are going to need help very soon to cover payroll and additional expenses. Mike, I'll let you address this one, but from what I know, I talked to Jim Duke from ComCare, and I know Jim's on the call, and I can't unmute you, Jim, because there's 159 people on here, and I can't find you in this list, honestly. But I know that several agencies, several ground and air agencies have already received supplemental funding through the federal government, supplemental lump sum payments. And I don't know if all ground agencies receive those, but I know several have. Mike, do you have anything to add to that on funding?
Yeah, I would suggest to go through your local emergency management office. I think there's some direction, and Drew just advised me that they've got some procedures to accomplish that.
Next question is from Carlos. Has there been any progress in K-Beam State Medical Director pushing out best practice protocols related to COVID-19 that would help the protocol approval issue? We're working through some of those things. I know Paul worked through the American Heart Association has put out new cardiac arrest algorithms for adult and pediatric, right, Paul? You added adult and pediatric yesterday. Was it published yesterday or the day before? Yeah. So if you go to the state protocol, right now it's been updated with the new AHA guidance as far as additional state protocol guidance related to COVID-19. Carlos, we can look at several different things. We're seeing a lot of people request protocol modifications for multi-dose inhalers and things like that. It's definitely something that we can look at if there's a need for it. The link for the PPE burn is now asking for account and passwords. What has changed? Paul?
So this is now currently going through the Kentucky Department for Public Health. The survey, we sent out the guidance. I'll try to share a link to it in the chat, but the guidance for that is that this is no longer a K-Beams survey, so we really honestly just can't help because it's not our survey. They're wanting to know your burn rate, and there's some calculators on there that can help you with that. And as far as the login and password, just really don't have any further guidance on that because it's a DPH thing. And if you'd like to reach out to your local or to the state public health, feel free. But I'll try to post the link to the guidance here in the chat.
Thank you, Paul. And we also pushed out last week, I believe, early this week or late last week, the 1-page 8.5 by 11 document from DPH on the PPE guidance. I think there's a QR code on there, and there's a bit.ly URL on there too that'll take you to the survey. We've had several people that were trying to log into old surveys, and through survey 123 with emergency management, and those links weren't working. So Paul just pushed it out right there, or AMR did. Thanks, Billy. Next question is from Robbie. How many Kentucky providers or agencies are known to be deployed to hotspots throughout the nation? The only ones that I'm familiar with, Robbie, other than AMR, who I believe AMR has some vehicles that are deployed to some hotspots under the federal ambulance contract. ComCare has 2 ambulances and 4 personnel in New York City right now. And I think they're going to, I talked to Jim with ComCare a couple of nights ago or last night. And those fellows, when they come back in a couple of weeks, are going to quarantine at one of the state parks on ComCare's dime when they get back. So, but they've been up there working hard, and I haven't had specific conversations with the AMR folks about their personnel that are deployed, but my assumption is that AMR has some personnel and vehicles deployed to New York as well under the federal ambulance contract.
So the question is from Jim, and it says, can EMS services send response type vehicles to low acuity calls with the intent of treat and release, not sending an ambulance until an evaluation of the patient by the provider in the response vehicle? So I think what you're asking here is basically, can we do chase car or mobile integrated health to send somebody out on a low acuity call to evaluate and see if they need to be transported or not? If I'm incorrect, Jim, just restate the question. But the answer is yes. We actually put it in the emergency orders and the regulations that you can send out a alternate response type vehicle to evaluate the patient and determine whether or not they need further treatment, or if they could be left at home to self-quarantine or self-isolate. So yeah, the answer is yes, as far as the emergency order regulations go.
And I want to just restate as well how the emergency orders work. The 14 emergency orders that are on the website may need to be modified at some point in time during the event based on new practices or best practices. And it's important for all of us to understand as well, you will have, under the emergency orders that are now in effect, the ability to hire a driver that's certified in CPR and has had an emergency vehicle operators course. You also have the ability to employ or have a volunteer EMR drive a vehicle. Now, these emergency orders will be in effect, or they'll be changed at the discretion of the executive director. But at the end of the declaration of emergency, our regulations will go back to what they were before they were modified. So the original regulations will immediately go into effect at the end of this declaration of emergency or at the direction of the executive director. So as you hire people, I know this may put you in a difficult situation because you may want to hire drivers or EMRs as full-time or part-time employees, but it's important for you to understand that when these emergency regulations, this is specific for this COVID-19 and the anticipation of massive surge. But after the state of emergency is ceased, our administrative regulations will go back. So you may end up having a bunch of EMRs and ambulance drivers, literally, that you can no longer employ in that capacity. So that's just something for you to keep in mind as you hire people. We want you to be able to hire people or bring on volunteers, et cetera, that are EMRs or you utilize as a driver if you choose to do that. We just want you to understand with full transparency that at the end of this declared state of emergency, the regulations go back to what they were before the emergency orders were placed into effect. That's going to do it for our questions today, and I appreciate you all for coming on, and appreciate everything that you and your staff are doing in the field. Let's just do everything that we can to make sure that our staff are safe and taken care of, and make sure that you all are taking care of yourselves physically and mentally as well. It's a taxing period of time for all of us, and we've got to keep each other in line and make sure that we've got everything that we need. Mike, I'll turn it over to you, and thank you all again for being with us today.
Thanks, Chuck. I'll just close out by saying, guys, we're not invincible here. Sometimes we think we are, but trust me, we need to watch out for each other. And as I close every week, I'm going to tell you, take care of yourself, take care of your staff, and take care of your family. Don't forget your family. They're out there too. So with that, hey guys, we're here for you. We're here to help you be successful. So if you need something, there's always somebody here at the State Operations Center Monday through Friday, and that could be expanding. But reach out to us, and we'll do whatever we can to get whatever you need. So be safe. Thank you.